Hey everyone, welcome back to my channel. It's Dr. Alessandro. Thank you for joining me. In this video, we're going to be talking about the removable partial denture, or partial, as some people call them. So I get the question sometimes when a patient is missing a number of teeth and wants to know what to do to replace them. Hey doc, what is a removable partial denture? How do you get to that point? What do you have to do? As I said, it's an option to replace a whole bunch of missing teeth, or some missing teeth, or sometimes even one missing tooth, depending on the preference of the patient, or actually other conditions of the patient, including medical. Now, I do have to say that we have to present all the different options to replace missing teeth. So in the dental world, option number one, by far, the Cadillac treatment, the Gold Star treatment, whatever you want to call it, is the single tooth implant, followed by a bridge, a fixed bridge. That is where some teeth are prepared and a missing tooth is replaced by preparing the teeth on either side of that missing tooth or missing couple of teeth, and then something is cemented into place after that is done. So those are kind of the two firm and strong options. And the removable partial denture ends up kind of being a third place option. It is a choice. I'm never going to say it's a great choice. I'm going to say it's an okay choice. I'll always set the bar at that level because I don't want people to think that this is the absolute best thing since sliced bread. It's an option, and hopefully it's satisfactory for the patient, but I'm never going to want to say that it's great. I'm going to say that at best it's mediocre, and it might not be mediocre. It might even be less than mediocre, but it's up to the patient to decide what he or she wants to do with their mouth and their body. So it's a choice to replace missing teeth. Now, what do we have to do to get to the point of having a removable partial denture? Well, first off, we need to make sure that the gum and bone tissues that are supporting the teeth are healthy. We can't just go ahead and make a removable partial denture when somebody has poor gum and bone health. That is, they have periodontitis that's not controlled, or gingivitis that's not controlled, because the removable partial denture will not work well. In fact, it will only potentially make things far worse for the patient. So you have to make sure that the gum tissues and bone tissues are as healthy as they can be, and that the teeth are in as stable a position as they can be in terms of their gum and bone health. So the periodontal health is really critically important. The second thing that's really important is that they don't have cavities. We can't just go ahead and make a removable partial denture when a person has a whole bunch of cavities or dental disease of the teeth. We risk having teeth potentially break and teeth that are supporting the partial denture, and then we have a problem. So again, gum tissues and gum and bone tissue needs to be healthy, and the teeth themselves need to be stable. Whatever problems there were have to have been fixed before we can start to prepare teeth for the partial denture, because teeth will need to be prepared for the partial denture. Ideally, teeth will be prepared in enamel. That is, in that white stuff that you see. Your teeth are all pearly white. Well, that white color, whatever it is that you have, on that outer layer of your teeth, that's where the tooth preparation for these is ideal. And as you can see, there's a little bit of a preparation on top of this tooth, this big chewing molar right over here. There are also other places that you can prepare. For example, if a patient has crowns or onlays of some kind, you can prepare on those. So you can do that. It's not as preferred as enamel, but it can be done. Fillings can also be prepared for receiving a partial denture, but again, it's not the best. In fact, now you're starting to go down the scale of what's good versus what's maybe not so super. So in any event, you basically prepare the teeth so that they can receive the partial denture. You want to make sure that the partial denture has clasps. Things are designed so that clasps can engage into undercuts along the teeth, and that way they can grip onto the teeth and they can stay in place. That is, the teeth help to anchor the partial denture in place. Now, what are some drawbacks to a removable partial denture? Some of the drawbacks are that your speech may change because now you're introducing something new into your mouth. So your speech may change. Your sense of taste may change. That's a big one. So your sense of taste may change, and that's important. You need to know that. Another thing is that because some teeth are missing, and and the partial denture is being anchored by other teeth. The partial denture may actually, over the course of time, make these other teeth these teeth that they're anchored onto a little bit loose. Because again, when you're putting it in and taking it out, you are always, basically pushing on them or pulling on them or, doing some sort of movement, which is not normal. Normally the tooth does not experience those types of forces. So you could loosen some of the anchor teeth, which receive the partial denture. So those are things to think about. And again, a removable partial denture is, one of the options that you have to replace missing teeth, and it is an okay option. Now, again, you can always choose to do nothing. If you don't want to do any kind of treatment, it is a choice of yours to do nothing to replace missing teeth. So it's a reasonable route. It's your mouth and your body. But other than that, you can do implants, you could do bridges, or you could do the removable partial denture. That said, hopefully this video was helpful and helped you to understand what a removable partial denture is and how it can be used to replace missing teeth and its relative level of effectiveness, which again, I will reiterate, I'm going to call it mediocre. It's an okay replacement for missing teeth. If you're happy with it and you've got removable partial dentures that work great, super. But I'm always going to say it might be okay at best, and that's the best you can hope or expect. So that said, again, I really appreciate you all joining me. Thank you so much for joining me on my channel, and hope you're all staying well and healthy.